Good day, dear colleagues. I'm happy that you connected to our webinar that uh, uh, is held by Crystal Vision Eye Clinics by Professor Aznaurian. We established a clinic in April in Bahrain, and now we are going to organize a series of webinars on ophthalmology that will be held each Wednesday. So we will be happy if you will attend all the webinars, and we will keep you posted about the next ones. Today's topic is very interesting, and I think for each pediatric and even adult ophthalmologist, it is one of the most serious questions. What type of strabismus surgery to do, when to do, what diagnostic we need to do for understanding the dosage of strabismus surgery, and what techniques to use to make best surgery for each patient, and make this surgery individually for each one, so that we will get the best result, and not in the aligning of the eye position, but also in the visual acuity and in the restoration of binocular vision. All that questions today will be showed by a great ophthalmologist, head of clinical department of Crystal Vision Eye Clinic, Dr. Victoria Balasanyan. Your topic will be different surgery techniques and various types of squint. If you will have questions during your presentation, please, there is a chat and questions where you can put them, and after the topic, Dr. Victoria will answer to them all.
Mainly about strabismus surgery, but we will also touch a little some aspects of diagnosis and examination for patients with strabismus. And it's very important for calculating the volume of surgery. Strabismus and nystagmus are not only cosmetic defects. So these conditions disrupt the functioning of most all parts of the visual analyzer, and may be accompanied by a range of visual disturbances, such as amblyopia. A functional decrease in vision in which the deviating eye is almost or not at all involved in the visual process. That is why the treatment of strabismus requires a comprehensive and fundamental approach. Currently, there are no unified standards for the diagnosis and treatment of pediatric eye diseases. That greatly hinders the accurate diagnosis and reduce the effectiveness of treatment. That is why we have developed and implemented under the direction of Professor Igor Aznauran a modern comprehensive technology for diagnosing and treating eye disease in children. The Straba Care System, this is a comprehensive program for the treatment of strabismus, which include an accurate diagnosis of the pathology of the oculomotors, a program of mathematical modeling of the operation, minimal invasive strabismus surgery technique, and development binocular function during the rehabilitation period after the operation. So within this presentation, we will focus mainly on the minimal invasive strabismus surgery technique, and on the comprehensive diagnosis of eye movement disorders. So well known, then any treatment should start with an accurate diagnosis. For this purpose, all our patients undergone a deep, very extensive ophthalmic examination, such as electrophysiological examination, visual evoked potential, OCT, in some cases, MRI examination. So, as for the standard diagnostics of the eye movement system, for sure, special importance is placed on synaptophore examination. So, this is well known for everyone, and this during this examination on using synaptophore. We include measurement of objective and subjective angle of deviation. Using the synaptophore, we determine the presence or absence of binocular function, functional scotoma, its localization, etc. So, in our clinic, we conduct more than just routine examination of eye movement disorders. In addition to traditional examination, we are using a video oculograph gaze lab developed by Professor Igor Aznaudan with our colleagues, developers from Spain, from Barcelona. So this device allows us to increase accuracy of determining the angle of strabismus, vertical or horizontal. And the most exciting part is that now we are able to conduct this examination using the gaze lab in our clinic, Crystal Vision, in Bahrain too. So in the automatically generated report, we have the ability to compare the deviation angle in the each gaze direction with a photograph of the patient's eye. It's significant to emphasize that this method can be applied for small patients, for small children, for patients with low vision, non-central fixation, for patients with nystagmus. So this is how the nystagmography protocol looks like. The software calculates the null point. So point when the point of blockage automatically, and still the examination. Doctor also has the opportunity to verify the accuracy of the data point and track the eye position at any given movement by independently reviewing the video nystagmography recording. Now about our this is nystagmography protocol. You can see. And you see that software calculate the point of blockage, and automatically it's very important for the operation, for the dosage of operation. So the next one. Now about our young patients. Unfortunately, so many doctors still have a lot of concerns about the surgery of strabismus of baby, precisely because it's impossible to determine the exact angle of deviation in such patients using standard techniques. But it's important for us to remember about sensitive period. This is the period when all our treatment surgeon most effective. It's very important that during this sensitive period, treatment and the further development of binocular vision in the post-operative period is more effective. So currently, there is a method that allows us to determine the angle of a strabismus, horizontal and a vertical, with absolute accuracy in young children. This is a portable device that allows us to determine the refraction, hyperopia, myopia, uh, astigmatism, angle of deviation, horizontal, vertical, interpupillary distance. And what's important, you do this measurement from a distance of 1 meter in patient age 3 months and older. So we use this device in our practice in crystal vision. And after the diagnosis, the next, so in our calculation, one important thing also in our calculations for surgery, we take into account not only the angle of strabismus, as is usually the case when planning a classical surgical intervention. We take into account a number of anthropometric parameters, such as anterior posterior axis, corneal diameter, transfer axis, refraction, and during the preoperative examination of patient, we carry out all these measurements we are interested in. And for the youngest patients, we have the opportunity, if it's necessary, to conduct the preoperative examination under the anesthesia with measurement of all parameters for accurate calculation of the volume of operation. And then after the high precision diagnosis of oculomotor function, we calculate the volume of operation according to the mathematical modeling program. The interface of this program you can see on this slide, and we use it in our practice since 2009, and it's a form of computer program that allows dosing the volume of the required surgical intervention, how many operations a patient need, frequency of upcoming operations. Professor Igor Aznaurian developed a mathematical formula that calculate individually for each patient the volume of the surgery, depending not only the angle of deviation and anthropometric and biophysical parameters. And in any case, the accurate diagnosis and calculation are not enough if the surgery technique itself doesn't ensure high accuracy of the intervention. And in this regard, we have developed a special minimal invasive low traumatic surgery technique, which implies compliance with a number of conditions. So this is preservation of integrity of the vessels. Well known that blood spilled into the tissue leads to severe inflammation, postoperative edema, and simulates the formation of fibrous tissue in the postoperative period. We consider the second criterion for low traumatic strabismus surgery, minimal injury to connective tissue. It's also reduced the adhesive process. And finally, the using suture material. So in our surgery technique, we, as a video, please. Now you can see the video of our surgery, and we don't use cutting instrument like scissors and scalpel. In our practice, we use a radio wave knife, um, which ensure, you can see how we use it on the video, which ensures that we comply with the condition that have just discussed. So The incision is made in such a way that the tissue remain intact, which ensure minimal development of adhesive process. And you can see we use 70 vicryl as suture material. Stitching is carried out using a special hook, right hook, which allows us to avoid damaging underlying sclera. Now you can see how we do all measurement in accordance with the earlier calculation. And now we do all measurement, then suture the sclera. Cutting for cutting muscle, we use the same knife too. You can see how we use the hook with a special protector, again for avoid damaging underlying sclera. And now you can see how we finish the operation. It takes only 10-15 minutes. And minimal invasive surgery allows the procedure to be performed in such a way that after 3-6 months, the post-operative scar is not detectable, even under the microscope. That's all. Then So, the use of precise preoperative diagnosis, our unique minimal invasive strabismus surgery technique, combined with the Straba mathematical modeling method, has enabled us to achieve a surgical dosage calculation accuracy of plus minus 5 degrees. We have been successfully using the Straba technology for almost 20 years. During this time, we have operated thousands of patients. In one of our scientific studies, we compared the recovery period between patients who underwent traditional strabismus surgery and patients treated with the minimal invasive Strabosoft technology. Criteria for comparative evaluation included tissue swelling and hyperemia in the post-operative period, as well as the rehabilitation period for patient, when a child could return to kindergarten or school. And so we operated on 7,207 children with concomitant horizontal strabismus, with 1,525 surgeries performed using the conventional surgical technique, and 5,682 using our post-operative radio frequency minimal invasive strabismus surgery technique. And you can see on the slide, our proposed surgical method allowed for reduction in post-operative tissue swelling and hyperemia in over 90% of cases. The rehabilitation period can be shortened to just 3 days. Therefore, the use of minimal invasive technique leads to a significant reduction in tissue hyperemia and swelling in the postoperative period, a considerable decrease in patient rehabilitation time, and practically eliminates the formation of adhesion. Dear colleague, thank you very much for your attention. That's all. Thank you.
Thank you so much, Dr. Victoria. Seems that we have a raised hand from Dr. Amot Rawat. Maybe you can write a question in the chat so we will be able to answer if you have any. Um, so I want to say that we will for sure send the video of today's presentation to all of you and to colleagues Also, you can share it with doctors with whom you work and know, because it will be in YouTube. If there is any other questions, you can put them in the chat. We will be happy to answer. If no, thank you so much for joining us today in the morning. Hope you will have a great day, and see you soon next Wednesday at 8 a.m.